Good evening and welcome to Doctors on Call. I'm Dr. Ray Christensen from the Department of Family Medicine and Community Health at the University of Minnesota Medical School, Duluth. And I will be your host for tonight's program on healthy living and prevention. Remember that the success of this program is dependent on you, the viewer. Please call in your questions and we will do our best to address them. The telephone numbers for your questions can be found at the bottom of your screen. Tonight our panelists include Dr. Gail Baldwin, a family physician with Lake Superior Community Health Center, and Dr. Jake Pernuski, a family physician also at Lake Superior Community Health Center and a faculty member in the Department of Family Medicine and Community Health at the Medical School in Duluth. Our medical students answering the phone tonight is Tori Jordan from Detroit Lakes, Minnesota, and from the medical school, Cheryl Pearson and Linda Liskowitz. And now on to tonight's program on healthy living and prevention. First of all, because there'll probably not be time at the end, a happy holiday season to all of you, and a Merry Christmas, Ben Owens. Been a bit since we talked to you. Tonight's program is a little bit different than we have produced in the past. This one is about prevention and care of yourself. If you will, the half hour of the 23 and a half hours of the day that we don't quite invest as we should. To start out, I'm going to ask Dr. Pernuski to tell me what he feels healthy living is.
Well, thanks, Ray. I think oftentimes people don't stop and think, what can I actually do to lead a healthy life or a healthy lifestyle? We think of it as something we have to do, but in reality it's the choices that we make day in and day out every day, not something that we do once in a while. And when I think of health, what I think of is being able to do what I want to do, when I want to do it, more or less without limitation, and then feel good about it at the end of the day.
Gail, prevention.
Prevention. I think prevention is sort of the goal of a healthy lifestyle, and eating properly so that you give your body good nourishment. And sometimes I think we need manuals like you'd have in your automobile that tell you when it's time for an oil change, so you know when to go and visit your doctor and just make sure all the fluids are up to par and all the parts are still working as they should and there's nothing abnormal going on. So prevention for me is things like getting your screening tests in a timely manner. For women, mammograms, pap smears are normal ones that we think of, and for men having prostate cancer screening, and for both having colon cancer screening. For kids, getting your immunizations from the time you're due growing up, and then continuing those through adulthood, including flu shots and tetanus shots and pneumonia shots and shots for shingles and things like that, so that people are able to prevent those illnesses that can be very, very detrimental to your ongoing health.
And just to expand on that, prevention is not always just linked to seeing your doctor or a doctor visit. What you mentioned are things that we as physicians can do to help our patients, but I think there's also a lot of prevention just in what we do around the house. It's injury prevention for our children. It's safety. Do we lock our doors at night? Do we wear a seatbelt when we're driving in the car? Do we turn our cell phone off as we're driving, or hand it to someone else to answer rather than take the phone call as we're driving down the road at 60 miles an hour? And so I think that there's for me, prevention, it's not just the things that my doctor can do to me or for me, but also the things that I can do or my family can do around the house to stay safe and be prepared for things which might happen in the future and try to head those things off, which could cause me or my family harm. And not all of those things involve seeing your doctor, although I do think your doctor can oftentimes be a good resource for what you may be able to do as an individual to help stay healthy.
Mm-hmm. How do you demonstrate for your patients good health?
Well, I try to be a role model in that I recommend that you take care of yourself, eat properly, get enough sleep, make sure you try to maintain a healthy weight, exercise regularly, that sort of thing. And often a patient will come in and I'll recommend a flu shot. Well, did you get yours? And I will say, yes, I did. And it didn't hurt that much.
I'm thinking of the balance of body, mind, and spirit just a little bit also for good health. And it's interesting. I think we know that stress, now we're into the Christmas season, and there's all of this food around, and stress and depression and families and all these other pieces. What does stress do to your appetite, and what does that do to your body?
Well, I think that many people deal with stress by eating too much or eating the wrong things, like picking the sweets or the overly fatty foods and things that actually drag their psyche down, drag their bodies down so that they don't feel as well as if they were to pick lots of water to drink instead of sweetened eggnog and lots of vegetables to eat instead of candy or treats. So I think that those are some of the things that happen during the holidays. But I think also this is a season in many cultures of some very spiritual parts of our lives. And I think for many of us, it's not seen that way so much anymore, but we'd probably be healthier if we did allow ourselves to address the spiritual parts of ourselves in this season.
I think even being reflective or meditative can be helpful, and just to find a place within inside of yourself which is calm and at peace, even if the world around you is in absolute chaos, can be really helpful and very refreshing. I'll often do this in the middle of a busy clinic day. I'm seeing patient after patient after patient, and the emails piling up, and patients are piling up, and there's more work to be done. And I'll take 2 or 3 seconds before going into a room, close my eyes, take a deep breath, just kind of center myself, and then go in. Or if I have downtime in between patients, again, take just a minute or two, close my eyes and just kind of find somewhere peaceful. And I think it allows me to regain something so that when I'm in the room with a patient, I'm fully there with that patient. I'm not thinking about what I was doing before that. I'm not thinking about what I have to do next, but really living in the moment. And I think to the extent that we can live our lives that way, we're less stressed. I mean, at a time when we're thinking about, the shopping we need to do, visiting family, traveling, last minute this, that, and the other thing, if we could simply be and get done what needs to be done right now and then move to the next thing, some of our stresses would go away. We'd get to them as they arrived. The other thing, Ray, I think that's really important in that you didn't mention is good sleep. And I think a lot of people don't get enough sleep. And as we don't get enough sleep, our body breaks down and falls apart, and our brain breaks down and falls apart, and we become more and more and more stressed. People need different amounts of sleep, but many people get too little sleep, and I think that contributes and makes all the other problems, weight loss, stress, and so forth, worse.
I want to go back to the stress just a little bit. One of my old students, John Bachman, who is a physician, family physician for Mayo Clinic, when on a tough day, used to just offer it up. And there's a point where you can offer it up and just say, okay, there's nothing I can do to change this, and compartmentalize your life and stay in the moment, which is really one of the ways of handling that. And I agree. On the sleep issue, it's a great discussion point. How much sleep should a person get, and how do you determine that?
You can take that if you'd like. In my mind, that varies. I think a general ballpark for most people is about 7 hours of sleep a night. The doctors speak is actually a J-shaped curve. Too much sleep can be harmful, and too little sleep can be harmful. And that sweet spot is around 7 hours on average. Now, we know that people who are older sometimes need less sleep. Adolescents in particular often need more sleep. And at a time when students have to start school earlier and their days run later with homework is a time when they actually need the most sleep. And so there's a period of time where 11 or 12 hours of sleep a night is actually not unreasonable for folks, even though they're not often getting it. This is something you can look up on the internet and say, how much sleep does the average person need? Most people can tell. I mean, you get a good night's sleep and you feel better. Don't get enough sleep and you find that the next day you have a short fuse, or you're a little bit more ill-tempered, or things take longer than they would if you've gotten a good night's sleep.
So circle around, because the good night's sleep doesn't come easily to a lot of people. And let's go back to exercise. We haven't talked about exercise, Gail.
Right. Well, I think that a lot of our culture is not centered around exercises. We drive to this and we drive to that, and we sit around. A lot of our activities are in front of computers or televisions and whatnot, where what the human body was made to move. And so kids who come home from school, sit down to do their homework and never get out to play, probably aren't doing themselves or their psyches any favors. And the same is true for adults. I know for myself, when I get out and walk the dog for at least a mile a day, I do much better during the day. If I don't get the dogs out and take them for a walk, I'm actually more sluggish. Although you'd think I use more energy to walk the dogs, don't I? But no, I actually get energy from getting out and doing something like that, something vigorous.
Plus the endorphins and the positive chemicals.
Yeah.
This is where I started out with the 23 and a half hours. There's a YouTube lecture, and I don't remember the site, but it's about the 23 and a half hours, and the person that's doing this is discussing the importance of the half hour, which is the walk and which is the exercise. Most cultures, most agrarian cultures and other cultures do about 10,000 steps a day, which is 5 miles. And we're nowhere near that. So exercise itself is really important. And that does affect sleep and how you would sleep.
The other thing that comes with that is we often talk about exercise in the context of heart health. And many people know, oh, you should get 30 minutes of exercise 3 days a week or 30 minutes of exercise 5 days a week. That's excellent for heart health, but our life is more than just heart health. I mean, our life is our sense of well-being, it's weight loss, it's relationship with family and friends, and oftentimes people find a way to exercise that's not just isolated by themselves, but involves others. I know for me, I like to get outside and often find it's very spiritual, walking through the woods or you know, I rock climb and, you know, me in the mountain. That sort of thing can be very meditative and very refreshing for the soul and for the mind as well as the body.
You don't listen to music when you're climbing?
I don't listen to music. Well, if I'm in the gym, there's music playing overhead, but other than that, no.
What about exercise for the mind? Well, we've talked about a little bit about the body and the spirit. We haven't really talked about the mind. Thoughts?
Well, I having a very strong family history of Alzheimer's and the knowledge that exercise, both physical and mental exercise, meaning having things you like to do, projects that you complete, reading, working puzzles, doing crafts, doing something that makes you think, helps to exercise your mind, helps to keep your mind sharp. And in fact, family members who have two different lifestyles, they've shown this in one, it was I don't remember the name of the book, but it was done on a group of nuns in, I believe, Mankato, Minnesota, where they had sisters, actually sisters who were sisters, if you will, the siblings who were in the same group of nuns, both of whom said that they could have their brains analyzed after death. And they were both found to have the changes that occur with Alzheimer's, but one, during life, demonstrated the changes of Alzheimer's in her life and was very infirm at the end of her life. And the other one, who was very vigorous, did a lot of active things, kept her mind very active in problem solving and reading and things like that. Although she had the exact same changes of her brain at the time of autopsy, she did not demonstrate the symptoms of Alzheimer's in her life, and they both died in a similar time frame of their life, late in life. So it is my thought that just like exercise helps to keep your body firm and your body healthy, mental exercise helps to keep your brain in better shape as well.
Question comes in about vitamins. Are vitamins advisable for the elderly? And then as you talk about that, what is the optimum proper dose of vitamin D?
You know, vitamins are an interesting thing. Over, you know, the last several decades, vitamins have been proposed as a solution for almost everything. There are actually very few cases where we've been able to prove that the vitamin is helpful. Folic acid in pregnancy is one example where vitamins are clearly beneficial for developing infants. But many of the other instances where we've tried to find that a vitamin can help, it turns out it doesn't help, or it doesn't help as much as we thought it might. And it really gets back to eating healthy fruits and vegetables, and we haven't figured out how to pull those pieces out of the fruits and vegetables to give us the health we need. Vitamin D can be very helpful in preventing fractures and actually preventing falls, which is interesting. There's some good research that shows that adequate vitamin D makes you less likely to fall, and in people who are at risk for breaking bones and breaking hips, this is very important. Especially in Minnesota in the winter when it's dark, we often don't get enough vitamin D. The optimum dose depends on where you start. And it depends also on your diet and how much you're getting through, milk or dairy products, which are fortified with vitamin D. 400 international units is a measure that's commonly used. Sometimes people use 800 international units a day. I think as a general recommendation, 400 to 800 international units in people who are not low on their vitamin D levels is a good starting point. And again, this is something that does need to be individualized, and so if you have concerns, knowing where you're starting from and seeing your doctor would be appropriate.
How much water should a person drink per day? And what if you don't drink that much? Is it harmful to you?
Well, I think that that has been a point of debate for quite some time, but 8 glasses was always what I heard as the recommendation. So 8 glasses of water, and for the longest time I preached 8 glasses of water, not pop, not coffee, not tea. And now I'm not so sure. I think that you need to remain hydrated. 8 glasses might be just fine for some people, might be a little over for other people who are drinking other fluids throughout the day, and might be not enough for someone who's very active, vigorous, and it's hot outside. So I think that what you need to do is recognize thirst when you feel it, and feed thirst with water, not with food.
But elderly, and I'm getting elderly, we don't feel thirst like we used to.
Well, then sip on a glass of water all day long, and then you won't, if your mouth is dry, you're thirsty.
Keep your urine clear. I guess that's the other side of that one too.
Yeah.
The other thing is that this great American desert in the northern latitudes now, with the humidity being very low, worse than desert levels.
Yeah.
350-pound person with many health issues is wondering what he can do besides going to the doctor, which he's already done, to take better care of himself.
Well, I'm not really sure what he's doing already, but 350 pounds, he'd have to be awfully tall for that to be a proper weight for that person. So the first thing is to try and reduce portions of food, to try and reduce weight would be my guess at what that person would need. Exercise is good, but it's important when you carry around that much extra weight to be generous with your joints, and so choose exercises that are not all weight-bearing, so things like swimming, bicycling, rowing, that sort of thing might be more helpful for someone in that weight category.
Walking in the pool?
Walking in the pool, yep. Water exercise.
But the weight loss is almost mandatory, and he needs some muscle building.
Yep.
Weight loss is important. It's also very hard, especially in people whom are overweight. Sometimes it hurts to exercise, and people don't want to do things which cause pain. I agree with your advice on the swimming pool. I think the swimming pool is wonderful because that can support some of the weight and take the weight off the joints. For this person, I think also looking at their life in general, just identifying what are their goals in their life, and what is it going to take for them to reach those goals can be helpful, and thinking about the little changes incrementally that can make a difference over a long period of time, rather than making big radical changes that are hard to sustain. Making little changes over time toward a long-term strategy for health can be very helpful. And then I think not just focusing on the weight, but looking at other risk factors like alcohol use, tobacco use, immunizations, mental health, and other things which contribute to our sense of well-being beyond just our physical health.
So is the Biggest Loser kind of way of looking at things where they attack it all might be helpful, although they go at it pretty hard. Alcohol consumption. Moderate alcohol consumption, okay? What's moderate?
Well, that's a really good question. I would say the studies would indicate that for a woman, one alcoholic drink, particularly something like a small glass of wine, and when we're talking about one alcoholic drink, we're not talking about a tumbler. I think that just like our plates have gotten bigger and our servings have gotten bigger in terms of food, I think a lot of people recognize that a serving of an alcoholic beverage has gotten bigger over time. So small servings of alcohol, as some people say, all things in moderation, and I think that alcoholic beverages can be consumed in moderation, but probably one alcoholic beverage for a woman in a day, 2 for a man, and maybe not every day. There's some study out there that would say that red wine is heart healthy, but I would have to say that you need to temper that with how much that person should be drinking. Sometimes it's a good excuse to drink when you say, oh, this is good for my heart. But I think the other part of that is if it interferes with your life in other ways. So if an alcoholic beverage interferes with your ability to sleep, or interferes with your day, and that you interact with other people in your life in an other than optimal way, maybe no alcoholic beverages is just right for you.
How about nicotine? We've skirted that issue today.
Oh.
Smoking is bad for your health. And there's pretty much nothing good about it. Nicotine itself is much less harmful than smoking. Much of the bad things that we get in tobacco have to do with burning of the tobacco leaf. So we can help people quit smoking by using a nicotine patch or other nicotine replacement, which is much less harmful than the stuff that comes out of the cigarette itself.
Female with pernicious anemia, Gail, is this inherited? Should she be on B12?
If she has pernicious anemia, she's not absorbing B12. She needs to get it somehow, whether that's by injection or sublingual tablets that sometimes people can use to get an adequate level of B12. But yes, it can be inherited. It's not a sure thing, but it's much more likely to occur in certain families.
CoQ10 supplement. Does it increase your energy and help your heart?
No one knows. We can't prove that it does either of those things right now, but there hasn't been enough high-quality research to say for certain that it doesn't either.
Why are docs more hesitant to continue prescribing anti-anxiety meds even though they are needed for stress reduction?
Well, some of the anti-anxiety meds are addictive and in the long run are not that beneficial if the persons who are trying to take them and not do other things to change the anxiety in their life aren't working on the other things. There are also lots of anti-anxiety medications available that are not addictive, and most of the doctors I know don't mind prescribing those. So I'm presuming this person is referring to the benzodiazepines, which we try to steer away from for fear of making people's addiction, making people addicted. They don't need to be addicted.
One other thing is sometimes other therapies are actually better than the medicine. For example, in flight-induced anxiety, people who don't want to go fly in airplanes, they can take medicine and it will help for that flight, but the next time their anxiety is even worse, and so they maybe need more medicine the next time the anxiety is worse. And in flight-induced anxiety, counseling or cognitive behavioral therapy is actually much more effective than the medications over the long term. One flight probably doesn't matter. A business person who's flying for a living, it can make a big difference.
What's cognitive therapy?
It's a way of retraining your brain to approach life differently.
Okay. 70-year-old female, should she have a pap smear yearly? Her doctor didn't say.
Wow, that's very much dependent on her prior history and any symptomatology she might have. Sometimes the recommendation is if you've never had an abnormality by the age of 65, you should have an exam, but not necessarily a pap smear.
Dental health.
The dental health, actually poor dental health is a huge cause of suffering and disability, and especially in a climate where people the economy is bad. It's really hard to get a job if you're missing teeth or have poor dental health. So I can't emphasize how important it is to maintain good dental health, brush your teeth on a regular basis.
Well, there's also a correlation between poor dental health and cardiac disease, which is becoming more and more well known. So I think there are other factors, not just appearance and social interaction and pain.
Washing hands important?
Absolutely.
Probably the single most important thing that we can all do to help prevent transmission of illness, especially over the holiday season when we're going to be visiting with family and friends. Wash your hands.
How about rugs and so on at home?
particularly for the elderly, it's important to throw rugs off the floor unless you want to pick somebody up off the floor.
Thank you very much, both of you, for coming in tonight. Great program. I want to thank our panelists, Dr. Gail Baldwin and Dr. Jake Pernuski, and our medical student, Tori Jordan, and Cheryl Pearson and Linda Liskowitz from the medical school. There will be no program next week due to the holidays, but you can join Dr. Alan Johns for a program on January 5th on mental health problems. His panelists will be Dr. Gary Davis, Dr. Victoria Heron, and Dr. Margaret Saraceno. Good night and happy holidays.